students, welcome to the Kernel series. Today let us discuss about prenatal screening. It is one of the important topics for your MCQs and Viva. So let us see what is prenatal screening. Prenatal screening is nothing but the screening test that we subject to the mother to evaluate the fetus in its in utero period. Okay, so whenever you do an investigation to see the well-being of the fetus in utero, that is prenatal screening. There are some routine prenatal screening which we do for everybody, but there are many others which we do not do for everybody but for high-risk patients. Okay, that is what we are going to learn in this class. So what is the main aim of this prenatal screening? It is detection and identification of the couple who are at high risk in developing a fetus or a baby which is having congenital or inherited disorders. So identify that in prior hand is our major aim in this test. So there are almost 3% of newborn babies which are born with congenital or inherited disorders, okay, which could have been detected in the prenatal period. So looking into this major amount of 3% of newborn babies, we are doing these tests. But we subject this to only the high risk patients, that is patients with the risk factors. So these are the high risk factors for whom you should do prenatal screening. Like a mother who is aged more than 35 years, as they are more prone to have congenital anomalous fetus. And if there is a family history of congenital abnormal fetus, or if there is a past history of baby with a Down syndrome or past history of open neural tube defect fetus, okay, that is when you have to do these prenatal screenings. Other than this, if they have recurrent abortions, then also you have to do, or if the mother or the father is suffering from any of the congenital abnormality or autosomal recessive disorders, then also you have to do these investigations to rule out that the baby is not suffering from any of them. These are the maternal risk factors. Some other risk factors are there where you have to do even if the maternal or no other risk factor is there. That is prenatal risk factors. There is no other risk factor, but still you have to do. If in scan you find out that there is severe oligohydramnios, then you might think the baby is not urinating well, then there might be some renal anomalies. Okay, that is when you have to do further screening. Okay. In case of severe oligohydramnios, severe polyhydramnios, or you can see any congenital abnormality in the fetus when you do an anomaly scan or an NT scan. Okay, these are the things when you have to do a prenatal screening. Now let us see what are the different methods that we have for investigating as a prenatal screening. Okay, routine non-invasive prenatal screening can be done for everybody, but these high-risk patients require these prenatal screening. That is biochemical, biophysical or invasive. So let us begin. The biochemical methods. Some of the biochemical markers that we take from the maternal blood and see for the congenital anomalies in the fetus, like maternal serum alpha fetoprotein. This is one of the very good markers. Okay, alone this can say so many things, but we use it in combination with the others, like maternal serum alpha protein with unconjugated estriol or free beta HCG, inhibin. Other than this, we can use PAP-A, that is pregnancy associated plasma protein A. So now you know the different biochemical markers that can be done for a prenatal screening. Now let us see when you have to do these biochemical markers. So if you begin with the first trimester, then you will miss out less. So always whenever you are starting, you start with the first trimester, second trimester and third trimester. That is when you will not miss out on many of the things. So let us begin. So in first trimester, let us see what we have to do. Firstly, in first trimester, first thing that we will do is for a normal patient from 11 weeks 0 days to 13 weeks 6 days. What is the scan that we will do? That is NT-NB scan. Okay, this is the primary need. Okay, this is a non-invasive investigation. This has to be done for everybody, and this is one of your most favorite MCQ questions. When you will do, for whom you will do. Okay, NT-NB scan has to be done for everybody, even with risk factor or no risk factor. Okay, this is a non-invasive and very easily identifiable investigation. Okay, that is why we have to do this for everybody. So once you did for NT-NB scan, it came abnormal, or if the patient is having high risk factors, then you will go for the blood investigation. In first trimester, what we will do, that is a double marker. What does a double marker means? As you know, double. So it has to have two investigations. One of them is free beta HCG and the other is PAP-A, that is pregnancy associated plasma protein A. So these are the two markers that you will do for a first trimester lady. If this is all okay, then you will continue with the pregnancy. So now coming to the first trimester screening, for a high risk patient, we will do both of this, that is NT&B scanning and the double marker. So these two together is called a combined screening. So these are all your very important MCQs. What is a combined screening? What is a double marker? What is a NT&B scan? Okay, these things you have to know in thorough. So we'll repeat. NT&B scanning is from 11 weeks 0 days to 13 weeks 6 days. That is done routinely for everybody. Coming to the double marker, that is including beta HCG and PAP-A. So when you do both of these things, that is NT&B and double marker, you call it as combined screening. And all these are done in the first trimester. So this ends with the first trimester. Now let us see with the second trimester. What is the second trimester scan, which is very important? That is the 5th month scan or an anomaly scan or a TIFA scan. What is TIFA? TIFA is TIFFA, that is targeted imaging of fetal anomalies. When you screen for a fetal anomalies, that is done between 18 to 22 weeks as an anomaly scan, it is very important, which is done routinely for everybody again. Coming to the biochemical markers, which we do in the second trimester, that is triple marker. Triple marker is done between the period of gestation 15 weeks to 18 weeks. What are the things that are included in triple marker? Firstly, free beta HCG, unconjugated estriol and maternal serum alpha fetoprotein. Okay, these are the three things which we will do for a triple marker between 15 to 18 weeks period of gestation. Coming to the quadruple marker, along with these things, when you add inhibin to it, that becomes a quadruple marker. And these two are your second trimester investigation. Okay, these are done if your first trimester investigation is abnormal or if the patient is having high risk factors to develop congenital abnormality. So let us, for an example, take if it is a congenital anomaly with a Down syndrome. What are all the findings that you will see? Why we are stressing on Down syndrome? Because it is one of the commonest and also it is easily asked in your Viva voice and most commonly asked in your MCQs. So you should know what are the findings in Down syndrome. So let us begin. A Down syndrome fetus is there. So what is that you will see in first trimester? What is the first investigation you will do? That is NT scan. What will be with the NT reports? The nuchal translucency will be more than 3 mm. Next, coming to free beta HCG. Beta HCG is raised in case of Down syndrome. And the other one in first trimester is PAP-A. So PAP-A is pregnancy associated plasma protein. I'm stressing so much because it is pregnancy associated. In your MCQs it comes as placenta associated. Don't get confused that it is pregnancy associated. Okay, it is reduced in case of Down syndrome. This is your first trimester screening. Now coming to the second trimester screening. In second trimester, what you will do? Firstly, you will do a triple marker. Triple marker includes beta HCG, which is already raised as we saw in first trimester. Secondly, unconjugated estriol, which is reduced. And thirdly, maternal serum alpha fetoprotein, which is also reduced. So this is all in your triple marker. Now adding to that is inhibin in your quadruple marker. Inhibin is also raised. So of the 4, beta HCG and inhibin is raised, whereas maternal serum alpha fetoprotein and unconjugated estriol is reduced in case of congenital Down syndrome fetus. Okay, that is why these findings are very important and very necessary for you to know. So now you know the different investigation and what are their results in case of a Down syndrome. Let us see what is the sensitivity of these investigations, because that is very important. Knowing the true positive cases or true negative cases is very important. Just because you did a test, that doesn't mean it is all over there. You should know how much is the rate at which it will detect the correct cases. Okay, that is why. And it is frequently asked in your MCQs. What is the sensitivity of the test? First trimester, what you did? The combined screening, which is sensitive almost up to 85 to 92%. The triple marker alone is sensitive of around 75%, whereas your quadruple marker is again sensitive of 85 to 92%. So these are all about your non-invasive prenatal testing. Coming to the invasive prenatal testing. What are the different invasive methods? Firstly, chorionic villus sampling. Secondly, amniocentesis or cordocentesis. These are the different methods which we will do for invasive prenatal testing. Whenever you do a non-invasive method and you find some abnormality, then that is not at all. Then you have to confirm with the invasive methods, because as we told, the sensitivity is only 92%. That is why whenever a test is detected to be positive in a non-invasive, you have to do an invasive method as your next step to rule out the congenital fetal abnormality. So what are the different methods? Cordocentesis, amniocentesis and chorionic villus biopsy. Okay, these are the different methods which we can do for an invasive prenatal diagnostic test. These things we will discuss in a different session. Before concluding, I want to let you know one more new non-invasive prenatal testing, that is cell-free fetal DNA, which is sensitive almost 98% in detecting congenital anomalies in fetus. Okay, this is the newer generation and very highly sensitive test, but the drawback is it is very costly and not available in most of the cities. Thank you for listening to this session. I hope you understood it well. For further detailed information or your queries, you can refer to our book, the DC DUTTA Textbook of Obstetrics. Thank you. Have a great day.